Hi, I'm Dr. Priyanka Mehta, gynecologist and laparoscopic surgeon. Today, let's talk about premature menopause or premature ovarian insufficiency. Menopause is when, after the age of 40, there is no period for 1 year, and that's when we diagnose menopause. That means the cessation of the periods in a woman's lifespan. Premature menopause is when less than the age of 40, there is no period for 1 year, and we also have done the diagnosis using the blood tests like some hormonal tests to diagnose menopause. Premature menopause is also called as premature ovarian insufficiency. Previously, this was termed as a premature ovarian failure, but then the term is not very pleasing, where we are trying to say that a woman has failed to produce the eggs. So now we use the term premature ovarian insufficiency. All women are born with a fixed number of eggs, and these eggs eventually, as we age, they get depleted, and once the woman runs out of the eggs or the ovarian reserve has totally been depleted, the periods eventually stop. The time frame from the time when your periods start either becoming less or you have symptoms of perimenopause, which could be 5 to 10 years before before menopause, is called perimenopause. For some women, however, menopause sets in earlier than the age of 40. And sadly enough, because women are not aware, these symptoms can be missed. So, what happens is that there are certain reasons. Sometimes we don't know the reason. It could just be idiopathic, which means there is no reason known and the eggs are just getting depleted, and so the hormone levels are changing, and then there is no period. Then there are also instances where menopause can, early menopause can run in the family. So if your mother or grandmother, your aunt, your cousins, they have had an early menopause, there could be a chance that, not everyone, but there is a chance that even early menopause can set in for that particular patient. Then there are certain autoimmune conditions where your body is producing antibodies, such as Hashimoto's thyroiditis and some other conditions where uh, other endocrine organs or other hormonal systems are getting affected. So these antibodies again are acting on the ovaries to reduce the number of eggs. Then there could be certain medical reasons or iatrogenic reasons like hormonal conditions like endometriosis, where we are, as medical professionals and gynecologists, we give certain treatments or injections for the women to reduce the, kind of shut down the ovary to reduce the estrogen levels. Then we give injections for some longer period of time, which can induce a menopause like condition. But once you stop those injections, then the periods get back to normal. So that's not actually a premature ovarian insufficiency. For some people, cancer treatment can also cause a premature menopause. Or if you have had a surgery like a hysterectomy, even though the ovaries are left behind, or if there is been a surgery on the ovary for conditions like ovarian cyst or endometriosis, if the eggs or the follicles are also depleted, there is a risk of an early menopause or a premature menopause. Now, premature ovarian insufficiency, how do we diagnose? So, if there has been very scanty period, that's what happens, and then there is no period less than the age of 40 for a year, and then we do some blood markers like you have the FSH is a test, follicle stimulating hormone. FSH value of more than 40 done 2 times at least 4 to 6 weeks apart, no period less than the age of 40, we think of premature menopause or premature ovarian insufficiency. Also, we check the estrogen or the estradiol levels, which are very low. For someone who is, say, at the age of 25 or 30, she has not got period for a year, and we do the tests and the FSH is high, more than 40, and estrogen is very low, this could mean it's premature ovarian insufficiency. So we also need to ensure that this lady or this particular patient now has depleted all the hormones that are supposed to be there in her body. So we have to also check for a scan to check her bones, which is the DEXA scan, And because estrogen and progesterone are very important, not only as sex hormones or hormones which help in the reproduction, estrogen, in fact, we have estrogen receptors on our brain. So some women can start feeling very moody, mood changes. They are having difficulty with the temperature regulation, where the estrogen acts on the thermal temperature control center of the brain. Estrogen also protects our heart. So younger women who have premature ovarian failure or premature ovarian insufficiency are at a risk of cardiac disease, because estrogen helps protect us against cardiac disease. Also, young women who are facing this problem, there could be symptoms related to the genital tract, which is vaginal dryness, vaginal itching, recurrent urinary tract infections. They also lose a lot of muscle mass, their bones become weak, they are feeling tired, there is brain fog, not feeling as good as they're supposed to feel. So what could be the treatment options? We have to replace hormones for hormones. If someone is less than the age of 40, she is facing premature ovarian insufficiency, there is no period, there is a premature menopause, we have options available for estrogen and progesterone replacement therapy, and also we women have small amounts of testosterone as hormone. So we also need to give testosterone replacement therapy based on a case basis. So what we do is that we would like to then check the hormone profile, where we look at your estradiol level, progesterone, the FSH, follicle stimulating hormone, LH levels, luteinizing hormone levels. We check your cortisol level, how your stress response is in your body. We also want to check a complete blood count, to check your hemoglobin, your sugar, sometimes your fasting insulin levels, check your testosterone levels. So we basically want to also check your micronutrients like vitamin D and B12. And with all of these blood assays, we will make a program for you so that we are able to give you bioidentical or body identical hormone replacement therapy. And this is the HRT needs to be continued for women who have had the premature ovarian insufficiency till at least the natural age of menopause. That is very, very mandatory. There is absolutely no controversy or doubt about that. And then continuing into the natural age of menopause after the age of 45 or 50, you also can continue to take the bioidentical hormone replacement therapy. Of course, the doses would change, because for women who are facing premature ovarian insufficiency or premature menopause, at a younger age, the levels of estrogen in the body are higher. So then we prescribe for them the estrogen, which can be in the form of patch, which can be in the form of gel or in the form of creams. So we need to give a higher dose. And because we are giving estrogen, we also need to give them progesterone, which is again either bioidentical or body identical natural progesterone, where we give it for at least the last 15 days or the last 10 days of the cycle, so that they get the withdrawal bleeding. So hormone replacement therapy, bioidentical hormone replacement therapy, is again very essential if you are struggling with symptoms of either a premature menopause or a premature ovarian insufficiency. For those women who are they have fertility wishes, then we check another test called anti-Mullerian hormone or AMH, and this will identify ovarian reserve, because you could have eggs or follicles left, and then you would be guided by your fertility expert regarding if you're interested in starting a family. So if you are struggling with you're younger and you're less than the age of 40, and you're having symptoms of suggestive of premature menopause, which could happen even as early as the age of 25 or 30, do reach out and get yourself tested. Thank you.